Okay, so my name is Dr. Richard Kim, and this is our webinar for June 19th today. So we'll get started. We're really going to talk about how stem cells really solve pain. And in order to do that, we're going to talk about some questions and answers. But here, we're going to start off with the question here. This is a question from Iris S. from area code 518. Wants to know about lower back treatment for arthritis and degenerative disc disease. So really what we plan to do today is talk a bit about what degenerative disc disease, what regenerative medicine is, and discuss really who regenerative medicine helps. Another question by John T. from area code 514. What is stem cell therapy? And talking about the fact that this is an alternative solution. This is completely non-surgical. There's no long-term medication involved. So it is a very unique process. When we talk about our goals as both patients and our goals as physicians, we all want the same sort of thing. We all would like to avoid surgery. We'd all like to stop medications. And of course, we'd all like to improve our improve our quality of life. But in order to do that, some of the common goals we have is that we all want a plan. And we want that plan to be safe. We want something with low risk. We want some short recovery, and certainly avoid any pitfalls. We don't want any hidden risks that are sort of unforeseen. We'll talk about two familiar examples here. The first one is a retired psychologist who's a patient of ours who flies airplanes for a hobby, runner, competitive, but also did it for stress relief. But the back pain really ended the running, and that meant no more competition, but also meant no more fun, no more stress relief, and certainly limited his flying time. 45 minutes, I think, is what he said before he had to bring the plane down. The second example is a chef. Then this person really enjoyed spending time with family, was in constant motion, moving heavy restaurant equipment. It was ultimately affecting his work and made it difficult to get through the workday, contemplating changing careers. But I think traditional therapies were really missing the target. And why I say that is that for surgery really meant something that was permanent, it was invasive, oftentimes associated with long recovery. And secondarily, medications, which is the other thing typically offered. As we know, steroids are a band-aid. They weaken and they damage tissue. And of course, repeat steroids meant only repeat weakening and repeat damage to that tissue. So not a great use of steroids. Over-the-counter medications certainly lessen symptoms, but that effect wears off, and then you just have to repeat the dose. So you're dependent on these medications, and all the while issues likely progressing and getting worse. 2 months after stem cell therapy for a patient, the psychologist was returning to run, ran the 4th of July race here in town, which was a 4-mile race. And I believe he's going to run it again this year in the next couple of weeks, but was running at a 13-minute pace and was happy to do so. Confidence to train for a half marathon, which he did with his grandson not too long ago. Chef went back to work full-time, back to providing for his family. This is really the key. What we're trying to do is break the cycle. And unfortunately, the pain that a lot of our patients and you out there are experiencing lead to degeneration, and then degeneration leads to more pain, and of course, so on and so on. But this really is the third solution out there. We're talking about a fairly high success rate, something that gives you years of relief, and something with guaranteed acceptance. It's cells that come from your own body, go out of you, then come back into you. So it's guaranteed acceptance and then therefore low risk. But what exactly is regenerative medicine? It's a new field of medicine. Really, the function here is to restore and not replace tissues, not with metal and plastic replacements. We're taking damaged tissue and turning it into healthy and more functional tissue. The different materials here to restore that includes platelets, which is otherwise known as PRP, and then also stem cells. So the green and yellow circle are really what PRP helps, which is sort of small to small medium type problems. And then when we're talking about medium to medium large problems, we're looking at something like stem cells. So if you're hearing me correctly, it's about the magnitude of the problem. So the magnitude of the problem, the severity of the problem matters. Here's a good video of cells moving and attacking. So green is good and red is bad. And red is where you're going to be driving your pain, your stiffness, sciatica, your nerve pain, your neuropathy, numbness, shooting, aching, and all of that. One of my favorite analogies to help explain this is the Pac-Man problem and solution. If the pellets are inflammation, then the Pac-Man eating the pellets one at a time is kind of like PRP. Many Pac-Man eating many pellets is like stem cells. The goal here is not to just get to the next level, but it's to beat the game and leave the problem behind entirely. And what we're talking about is being able to do that for 5 to 10 years in a lot of these cases. Where do the cells exactly come from? So as the pelvis spins here, on that back side of the pelvis is where cells are removed from, and then we're reintroducing them into parts of your spine, like you see on the right-hand side, into the discs, and then helping them regenerate. This is a typical timeline and schedule for us in our office, and everybody does this slightly different, but for us, this is how we've achieved as much success as we have. And that's first starting off with a consultation, and then pretty soon thereafter, we're interested in getting an MRI, and the MRI can happen anywhere from the consultation up to the second injection. But usually after that, then we're doing our first platelet-rich plasma, which is an injection, followed by the second platelet-rich plasma, which is also when the stem cells are involved, and then lastly, the third platelet-rich plasma. But once that's done, we're reintroducing you back to physical therapy, chiropractic care, exercise, and your normal activities are now resuming from that third injection. What kind of problems do we help? Well, stenosis, arthritis, degenerative disc, sciatica, and a lot of these problems can exist in the neck as well as in the low back. Lower body issues, arthritis again, bursitis, meniscus problems, meniscus tear, different types of meniscus damage, Achilles tendon, ankles. In the upper body, rotator cuff, arthritis of the shoulder, tennis elbow, carpal tunnel at the wrist, very common things, even down to the thumb, if you will. A lot of people want to know, am I a candidate? And basically, anything that is injectable or operable is also amenable to stem cell therapy. So it's important to have first that diagnosis. The key here is an accurate diagnosis leads to accurate location. And if you have the accurate location, that means your therapy is going to be accurate as well. Remember, for us, we have an in-house MRI, and so we are able to have that sort of perfect location and accuracy when we go to do our injections. A question we get often, what if I've had surgery? And the answer is yes. Even still, we can help. But it's important to have that first consultation so we can understand what surgery you've had, what limitations you might have developed in that. It's important, again, making that diagnosis, having those images, doing a history, doing an exam, sort of the traditional parts of medicine. The type of surgery matters, whether it was arthroscopy, fusion, or rotator cuff. A lot of some frequently asked questions for this is, where will my stem cells come from? Stem cells, and I showed you, come from the pelvis, and in some cases, we take stem cells from fat. How long before I can become active? So from that stem cell PRP to that third PRP, it's about a 4-week window. But once we achieve that, then you're not only returning to physical therapy, but you're back to normal activity and back to being active. When do you usually feel the benefits? So the beginning of the benefits start typically within about the first 4 weeks, and then max benefit really varies per person, but it usually takes a few weeks after that. How long will the tissue stay repaired? For us, we've been doing stem cells now and regenerative medicine for a full decade. And so we've seen people go anywhere from 5 to 10 years, depending on what we're injecting, depending on the severity, depending on a couple of different factors. And the last question is how well this works. Certainly hard to say, because it is very individualized. I will say that the majority of our patients get majority relief. So for a lot of the patients who come to us are getting great results, but a couple of factors to talk about there. And certainly important for us to learn about you and what you're looking to achieve through the consultation. Let's go through some questions and answers here. The first question here is from Josh W. at area code 607. Use of stem cells to reduce pain from cervical herniated disc and lumbar bulging disc and degenerative disc. What are the associated risks of stem cell treatment and percentage of success after treatment? So degenerative disc disease really is about the jelly leaving the donut. And so if jelly donut is our disc, this is one of my favorite analogies. So degenerative disc means jelly leaving the donut slowly. When the jelly leaves the donut suddenly, we're talking about herniation. Stem cells means helping keep the jelly inside of the donut versus something like surgery, where you're trying to prevent the donut from, from the jelly from leaving the donut with things like fusions and things of that nature. The risks here for stem cells and platelet-rich plasma are quite minimal, whereas with things like surgery, by cutting it increases your recovery time. Success is quite individual. However, for us, thankfully, the results have been excellent. Denise R. from area code 315 asked about degenerative disc disease, facet joint hypertrophy, and Schmorl nodes. So degenerative disc disease, usually that's jelly leaving the donut, sort of the backside of the donut, if you will. And Schmorl's nodes means that the jelly is leaving the donut both above and below the donut, which isn't how typical jelly donuts lose their jelly. For us, for stem cell therapy at Richard Kim Medicine, for us, we're really focused on the functional unit. That means whether it's the disc or facet joint or the nerve, we're comprehensive. So we're going to approach and address all the different things as part of that functional unit. And that does mean including the disc and other parts of your spine as well. That's why for us, it's important to have this multi-stepped, multi-targeted, comprehensive process that includes the MRI, just so we're making sure that we're not going to ignore anything or miss anything. So we really try to be as comprehensive as possible. Lisa A. asked from area code 315, can someone with prostate cancer be a candidate for this procedure? 64 years old. What are the risks of this procedure? We've had many similar situations. For us, the important part in doing this process with you is that we have that conversation with your oncologist or your cancer specialist, and we'll go through and we'll explain the risks and what we think is and is not possible. But again, for us, the risks are minimal. We're talking about the possibility of injuring to nerve, artery, muscle, bone, tendon, but a lot of it has to do with our skill, our expertise, and thankfully, with touch wood, we've had very little, by the way, of risk and injury, actually none. So thankfully there. Robert N. asked from area code 518, will stem cell therapy help my back issues? So yes, right? But back issues need a diagnosis. So when you say back issues, we need to know exactly what it is in your back that is affecting things. Is it degenerative disc? Do you have stenosis? Do you have arthritis? What are these things? And the chances are, Robert, that at 60% by the age of 60 have developed some level of degenerative disc in the spine. So if you're 60 and above, the chances are greater than 50% that this is what you're dealing with. And so for us to meet and have that consultation is important. We also have the option of having the MRI in advance, and therefore when you do come to us, we already have a little bit of information going into things. So there's some options for everybody out there. Ken C from area code 315 said, I have a few cervical issues with stenosis and ruptured discs indenting the spinal cord. That sounds problematic. The cervical issue has worsened over the past year since the last MRI. I also have L5 issues with having that disc repaired twice. It has since re-ruptured and very little disc material separating bone. Lower back pain and S1 issues. 56 years old, retired military, TRICARE reserve. So for us, for you, both the cervical and lumbar spine are both treatable. They're both parts of the spine that we treat regularly, so we feel quite comfortable that this is something that'd be applicable to you. For you, you know, likely if you go talk to a surgeon, the next surgical option is a fusion, and so that's just for you to know and to understand. Know fully well, though, that if you do choose that surgical route, adjacent segmental disease is the problem that a lot of people face, and that means that the fusion is not allowing the bones to move. That means if you forever fix two bones, then the level above and the level below now have to become more flexible in order to compensate for what you've lost here. So even after multi-level fusion, successful therapy and pain and reduction in quality of life is possible through regenerative medicine and through our stem cell therapy. And we've helped many, many people with even after spine surgery. Unfortunately, the commercial insurances, Humana and otherwise, do not cover these sorts of therapies. But that's one of the unfortunate limitations we have in our healthcare system. Kim O from area code 413 says, I have disc disease, slight ruptured disc, restless legs, jerking of my body. In the past, had surgery for spondylolisthesis, had injections in my back, no relief. So this is a pretty common scenario for us. So got disc disease, now starting to create more problems, tried the traditional injections like steroids, like we've talked about before, but they've worn out, or they've built tolerance, or however you want to describe it, have just sort of lost its impact, lost its efficacy. It's important to know that this disease can be responsible for a lot of your lower leg nerve problems, and even though you've had surgery for spondylolisthesis, stem cell therapy is possible. We can still help. So that's an important thing for you to know, Kim. Eddie M from area code 518. I'm a golfer, low back pain, tightness through the spine. So for golfers, and it might be golfing, it might be pickleball, it might be walking your dog, being able to do these activities pain-free really is how we define a lot of our quality of life. When a lot of these sports, things like golf and pickleball and walking and running are pretty common, both sports and activities for a patient. And we've been able to get them back to sport successfully. It's not overnight, and it shouldn't be expected to be, but we get there. We get there. It takes a few weeks, but you're going to notice steadily, week after week, that pain is getting less and less, and you can do more and more. So you may not be able to play all 18 holes soon after, but it will get you to play at the range, and then 9 holes, and then 18 holes eventually. Nellie R from area code 518, how stem cell therapy can help my pain from bone-on-bone osteoarthritis, knee and spinal stenosis, herniated discs in the lumbar. So osteoarthritis is one of the most common diagnoses for us in the knees, even people who have, quote, bone-on-bone level dysfunction. Stenosis and herniated discs, again, are pretty common things that we see in our office, and things we just, in fact, treated today. These are separate procedures, but we can help overlap them. So instead of having, say, 6 visits, we can wrap this up into 4. And certainly when you come see us, talk to us about that. And for different things here, we're talking about, 5 to 10 years of some real relief. And a few factors go into that, but that's about pretty common for our patients with osteoarthritis of the knee. Mike S. asked from area code 514, my L5S1 has a torn annular disc causing shooting and pain down the left leg to the feet. So annular tear really means a breakdown of that donut, going back to my jelly donut analogy. And you can see in this picture, in the magnified picture below, how close of a relationship that disc to the nerves are, and the nerves there are in yellow. We've had patients who've had annular tears, undergo stem cell therapy, do the MRI somewhere down the line, and the annular tear is then healed and resolved. And we're talking about people who've had annular tears for years, but after stem cell therapy have had it go away. So some real power, some real amazing things happening with stem cell and annular tears. Mark W. from area code 315 says, I have pain from compressed discs and spinal stenosis. Can we treat this? I also have arthritic knuckles. Yes. So for disc and stenosis, absolutely. This is one of our most common reasons that we treat and do stem cells of the spine. Knuckles, this is kind of a tricky one, right? So there's really no such thing as a knuckle replacement, not readily available. I know in some offices such things exist, but after steroids, there aren't a whole lot of options. But we've treated stem cells in knuckles quite frequently. And we've had it done numerous times for patients and had great results. And that's not just of the thumb, but all the way down to the pinky. So a lot possible there. Miriam Z from 514 said, I have back, hip, and ankle pain. So spine and hip arthritis, a lot of these things sort of travel together. So when you're having pain in both of these spots, I wouldn't be surprised if you've got 2 different diagnoses. So it's certainly important for us to see you, examine you, and listen to your story. So stem cells certainly apply to both. It's a different process, but once again, can be overlapped. So instead of 6 visits, turn it into 4. We typically will approach the spine first. So that's one of our important fundamentals here. Once we treat the spine, we really feel like you can help develop core strength. And then anytime you have core strength, developing strength in the hip and strength in the ankle down the line becomes much easier. So Iris R from area code 787 asks about the knees and lower back pain. Again, pain needs a diagnosis. For us, example in the knee, could it be arthritis? Could be a meniscus tear? It's important for us to meet, listen, and listen to you and understand what that diagnosis is. But if it does turn out, whether it's arthritis or stenosis and a lot of these degenerative conditions, for us, we've had excellent responses to our stem cell therapy. And our stem cell therapy, as you can see, we've had experience. We've had 10 years of experience, and we've developed a slightly unique protocol. And because of that, we really feel like our difference has shown. Severity matters. So you say knee and low back, but we need to understand what that means. How functional you are because of these pains is important. A lot of times we tell patients we can inject for pain, but we really can't inject for strength. So developing strength is something you're going to have to do, but we can certainly help remove that pain barrier so that you can go on to develop strength. Sandy J from area code 315, any recommendations for spondylolisthesis as well as degenerative disc disease? So spondylolisthesis, this sort of poorly aligned block tower is our example of spondylolisthesis. And when the two blocks don't line up is what spondylolisthesis is, and that's two vertebrae. And unfortunately, that means that the disc that lives in between them aren't lining up as well. And this then, of course, contributes to your stenosis. And so we see a lot of degenerative disc in a lot of people who do develop this spondylolisthesis because now your disc is not aligned as well. Again, for us, a very frequently treated problem. Fern H from area code 585 says, will this help with spondylolisthesis and spinal stenosis? Again, similar question. But to get into this a little bit deeper, when the bones don't line up, the cartilage end plate, and that's that circled in red there, when the cartilage end plates don't line up, the disc no longer has adequate nutrition. You heard me correct. So the disc does not get nutrition from arteries and veins like other parts of our body, like our skin and our liver or kidneys. Our discs receive nutrition through that what we call cartilage end plate. And so when you have a spondylolisthesis, that lineup for adequate nutrition isn't there. So that's a problem. And so you can understand, well, if I don't have nutrition, then don't I starve? Well, the other way we call that is degeneration. Well, don't I degenerate? Absolutely. And that's how degenerative disc happens. So on top of that, not only are you not lining and the disc is degenerating, but the stenosis has developed. So instead of having, two lined up holes, if you sort of move from side to side, then you are now pinching off that canal and developing stenosis. So that bad alignment really changes the relationship of the cartilage end plate, and then, of course, to things like your spinal cord. Jonna R. From area code 518 said, what treatments are offered for the osteoarthritis and bursitis and nerve pain I have in various areas of my body? Had 5 surgeries in 6 years, 2 knee replacements, lumbar and cervical stenosis, and carpal tunnel in left hand, again after 38 years. I hear you. It sounds like you've had your share of surgeries for your share of problems, but now some of the problems are starting to rear itself once more. It's important to know for things like bursitis and nerve pain, something called radiculopathy, and that's when a nerve is irritated down a certain path. And what happens here is that you have to address the issue at the source of the nerve irritation. So for us, for something like the nerve pain going down the sciatic nerve, for example, is that from degenerative disc disease? Is that from arthritis? Is that from stenosis? Understanding those components is important. Once we can identify where that nerve irritation is coming from or that nerve pain is coming from, then we can help address the underlying problem. So for lumbar, cervical, carpal tunnel issues, all treatable for us. These are all things that we've just treated today, in fact, and things that we're very, very familiar with. We're dead set on getting to the source of the pain and not just providing a temporary Band-Aid with steroids or things of that nature. For us, we're doing, through our protocol, we're seeing results that can go anywhere from 6 to 10 years for a lot of the lumbar and cervical issues. So certainly important to come and talk to us about that. Diane A. from area code 732 simply said sciatic. And again, the sciatic is a nerve that starts in your spine, as you can see in the top circle, and runs down the body. So where the sciatic nerve is irritated is important. The sensation and the muscles in your legs and your glutes are all controlled by these nerves. These nerves are wires that connect you from the spinal cord down to the level of the muscle, but have to know where the nerve is pinched, where that nerve is irritated. And it's important for us to also know whether this is temporary or this is permanent damage. Tim Z said, looking for a different direction of back maintenance. Don't have specific questions. Hopefully through this process, Tim, you heard about what we do. And hopefully we did a pretty good job of explaining ourselves. For us, it's important for three major components of regenerative medicine. Number one, a physician who's has the ability to make those diagnostics. Number two, has the ability and the experience for cell processing or material processing. And this, I can't stress enough. If you are too dilute or you aren't creating the right material, the injection and the therapy won't work, no matter how good the diagnostics are, and no matter how good you put the needle into the right place. And the last thing is, of course, being able to put the needle into the right place, being able to deliver the therapy to the right location. This is a pretty important component. So all three of those things: diagnostics, processing, and needle placement. Okay. So that brings us to the end of our webinar here today. What I'm going to offer to those who are watching this is a free consultation. And certainly just mention that during your call for consultation that you saw the webinar. The catch here is that you have to call Friday by noon. And our phone number there is 518-871-9900. And for those in the Montreal and Canada area, 514-697-8919. You can also make your own consultations online at richardkimmedicine.com. Future webinars will be at /webinars, and you can also watch older webinars. And if you're interested in creating your own MRI appointment and then getting more answers before the conversation, that's possible with /MRI as well. The next webinar for us will be on July 17th, again at 5 o'clock, barring any late days. Should start at 5 p.m. Now, for those who are watching, if you hit the Q&A, you could certainly ask some questions. I'll hang around for a minute or two to see if anybody's got questions and give a chance to ask and answer them live. But otherwise, I appreciate you guys bearing with me even on the late start here. Okay, so it seems like no questions have been raised. So once again, I'm going to thank everybody for showing up and listening to what we have to say about regenerative medicine. And we'll look forward to seeing you at the next one. Oh, here's a question. Sorry. Anonymous. How fast do your own stem cells regenerate as opposed to embryo stem cells? How fast do your own stem cells regenerate as opposed to embryo stem cells? Stem cell regeneration is a rather rapid process. I mean, if you want to compare it to other sort of cells in the body, this usually can take anywhere from hours to minutes at times. But I think what you want to focus on is how long before you see symptomatic results. And for us, it's, about the majority of our patients see the beginning as a result in the first 4 weeks. I couldn't really answer for embryonic stem cells because we don't do embryonic stem cells, and neither can you find them here in the States. So follow up to what you're asking, anonymous attendee said, I meant as opposed to umbilical cord stem cells. So again, we don't do that here either. So in the United States, there is no viable umbilical or embryonic stem cell product. So FDA has not approved one. So if somebody says you're getting it, I would really question hard as to where those stem cells came from, how they got it, and how they were approved to utilize them here in the States, as there isn't a FDA approved process for that. Somebody's going to ask generally after that, well, what about in other countries? Other countries don't have an FDA, or they have a different version of the FDA. So you're relying on that country's regulation process to say you're getting what you're actually getting. And unfortunately, that means it's sort of up to them. So if you have a corrupt government and a corrupt regulation process, are you in fact getting what you say you're getting? This is the hard part about overseas products and overseas processes. I can certainly only start to talk about ours. So we utilize uncultured, unmanipulated, and minimally processed cells that come from only you. And in general, we are seeing results as early as within the first 4 weeks. So hopefully that answers your question. Any other questions? Okay, perfect. Once again, thank you, everybody, and talk to you soon.